Across Ghana, economic pressures are quietly reshaping the traditional family support system. As many young people move away in search of work to support their families, a growing number of elderly parents are left to manage daily life on their own. In Gomoa Obuasi, this reality is becoming more evident, raising concerns about care, support, and the future of aging in the country. Samuel Yeboah Adams reports.
At 90, Mami Miss world has grown smaller.
My
daughter is normal. I now live with my granddaughter, who is currently in school. In the house, it's mostly the neighbors who help me around.
But for Daniel Lesuman, a resident who steps in as a caretaker, life would have been even more difficult, especially after losing her sight.
Whilst she's an old person, we have to support her because she doesn't have any child right now, so we have to support her in every corner. So when she's coming to hospital, when the girl is not around, we have to bring her to the hospital, and after that we send it back home.
For others, the silence is much deeper. With no dedicated person to care for her, life has become a lonely journey at 60 for Ekuateria.
I'm mostly alone in the house. All my grandchildren are not closer. I do my own cooking and only get assistance when some of my children come around.
The situation is no different from Manan, who looks after her 100-year-old mother.
She fell down recently and we took her to the hospital. There, we realized that her health insurance had expired. We were then told that she is old, so we could not go back.
Across Gomoa Obuasi and many rural communities in Ghana, elderly residents share similar stories. They live with little or no daily support, not by neglect, but as a result of circumstance. Nana Kweku Dadeban is the Chidomhin of Gomoa Obuasi in the central region. Our old people are quite numerous in our community, yet most of them do not have any support system. In Ghana, the population of persons aged 60 years and older has increased from 213,477 in 1960 to nearly 2 million according to the 2021 census. The World Health Organization has projected that by 2050, 80% of the world's older population will live in low and middle income countries.
Research has indicated that the biggest prompter of change is urbanization. So more and more of the continent is moving from rural areas to urban areas. And the main feature of the urban space is individualism, where people start to rely more on themselves than on a community that they've built.
As people age, they become more susceptible to chronic illnesses and mobility challenges, making regular access to health services essential. Dr. Frank Dodu is a public health expert.
When they are coming to hospital, they tend to come to hospital alone. So if their loss of function is severe, then there is a challenge because you have to be able to communicate your interventions to them. But if they are themselves struggling to appreciate what you are saying, then you would wish there was somebody that came along with them so that it could support. So it is a major issue.
In communities like Gomoa Obuasi, many elderly residents rely on the health facility as their only source of care, where staff attend to those who arrive on their own, often providing care beyond routine.
I know we've lost touch with how we are certain kind of communal living systems, but we can always revive it. We can look at it that we are all going to age one day.
While initiatives like free primary health care, the National Health Insurance Scheme, and the Mahama Care seeks to improve access to healthcare in Ghana, they do not address the unique needs of the elderly. Dr. Samuel Kaba Akoria is the Director General of the Ghana Health Service.
So what I tell people is that the aged, the retirees, their present is our future. If we don't do anything now for them, remember, very soon we will all be retired and we'll be there. And then we look back and said, no, nothing was done. No, nothing was done. No, we didn't do anything for ourselves. Because at the time we thought we were doing for them. But today they are them. Tomorrow we are the them. So that particular policy has been, we've advanced a lot in it, and a lot is being worked on.
Beyond healthcare, a national aging policy was drafted in 2010, but it never came into fruition.
The government has been interested in the LEAP program, which helps a lot of vulnerable demographics, especially the elderly. So that's good. But LEAP is really focused on the financial part of it. There's some NGOs that also focus on older people, like Help Age Ghana and so on and so forth. And they also do a job there. But I think more needs to be done. We don't really have a geriatric care policy or model that is well known and well funded and well supported, which I think we can work on.
For many of these elderly people, the need is simple: consistent care, presence and support.
Things are very difficult. So we want to urge the government to support old people.
I am appealing to authorities to come to my aid.
For Ghana's aging population, the question remains, how do we care for those who once cared for us? Samuel Yeboah Adams for TV3 News, Gomoa Boase Central Region.
Very thought-provoking question at the end of that report. Good one there.